I'm pleased to be joined today on Health Beat by Dr. John Lammli, orthopedic surgeon with Faith Regional Physician Services Orthopedics. And we're talking about joint replacement. So Dr. Lammli, what are some signs and symptoms that one might experience that it may be time to consider a joint replacement?
It's a good question. When I see patients that are ready for total joint replacement, you see a wide array of reasons for why they're ready for joint replacement. You see patients that have had progressive loss of activity and function over the years. You see patients that have had multiple modalities for arthritic pain. They've had all the treatments with steroid injections, gel shots or viscosupplementation injections. They've had physical therapy, NSAIDs, and rest and activity modifications. But it really comes down to subjectively what the patient finds as being their limitation.
Sure.
Every patient has a different goal that they want to get back to. Here in Northeast Nebraska, you see a lot of patients are involved in the agriculture community. They want to be ready to be able to farm come springtime or fall, and they're having problems getting in and out of a tractor or being able to walk in fields. You also see your active patients who want to go hunting or participate in golf or other sports where they're saying they're having difficulties being able to walk for prolonged periods of time or go up and down stairs and get back to the functional activities that they enjoyed previously. When you look at those patients, what I usually tell them is, you'll know you're ready when you've exhausted your other options and you realize you've become a spectator in life, not a participant.
Sure. Yeah.
That's typically when patients have that question placed before them and they start to look at functionally how they're doing, usually they tell you when they're ready.
And from what I understand, the technology behind joint replacements today is far, far and away better than it was even a mere 10 years ago.
Joint replacements that 10 to 15 years ago might have lasted 10 or 15 years. Now you're looking at some of our data on implants that are lasting 20, 25, 30 years. And it's all based upon the fact that technology has improved and our understanding of how joints react and respond to those implants has become much better.
Well, I'm sure that's great news for a lot of folks that are watching today. Thank you very much.
Thank you.
All right. That's Health Beat, brought to you by Faith Regional Physician Services.